Okay, Arlene is our patient today, and this is a very interesting case, and nobody wants to be an interesting case. But yes, unfortunately, this will be a good lesson really for everybody here. And that is, let's take a look at Arlene. Now, how long ago did you have Botox?
3 weeks ago.
3 weeks ago. And they treated which area, Arlene?
My forehead.
Just the forehead here. Okay, so now let's take a look at the forehead, and I just want her to sit relaxed here. And the forehead looks nice and smooth, right? And that looks pretty good here. And how many units did they put in your forehead, Arlene, as you remember?
40.
40 units. Okay, so 40 units of botulinum toxin, but in her case, Botox, in the forehead. Probably a little too much, because describe the problems that you were having, Arlene.
Well, I feel like my, I know it's not this, but it feels like my forehead bone is swollen because it's like real big here. And when I do this, I have big, Spock eyebrows, and it just doesn't look natural to me.
Right, and you also now have a little bit of hooding that you were talking about. Talk about that.
My creases on my eyelids just stay when I hold them. I have to really pull on my eyelid to put makeup on.
Right.
And that was not there before.
Right. And but I mean, it does look good, but now we've got a host of other problems. So let me go ahead and just tell everybody, why are we having these problems here? First of all, 40 units in the forehead, especially with someone with shallow eyes like her, is probably a little too much. It does the job of really smoothing everything out, but first of all, number one problem is raise your eyebrows again for us, okay? This part of the frontalis here, and as you can see here, is still way too active. And with all this completely just blocked out, and you can just relax again, then when she goes into a surprise face, she gets those Spock eyebrows, which nobody likes. And you're trying to control it, right? I mean, you're saying you try not to raise your eyebrows here. Okay, now, second issue here is make a mean face for us again here. Okay, now, her glabellar was not treated here. Second big problem with this case, just relax, is because this was completely knocked out and this glabellar is still active, and you can kind of almost see this the way the light reflects off, and this is what she says. She feels like this bone is almost swollen. That's not bone. This is all glabellar complex muscles of the corrugators and the procerus that are working now too hard, because you should most of the time not treat the frontalis without also treating the glabellar here. I would bet also that her medial eyebrows are being pulled down just a little bit, and that's also what's causing some of this hooding, because all this is working hard, pulling everything in, and because this frontalis is knocked out, this has dropped. This is pulling this way, and that is causing some of the hooding and everything else. Now, the nice thing about botulinum toxin or Botox treatment is it will reverse itself, but only with time. And because 40 units were put into this forehead, that's going to take a few months to go ahead and work itself out. But in the meantime, what we can do is we can help her symptoms a little bit and that's what we're going to do, is we're going to treat this glabellar complex with some botulinum toxin, and that's going to relieve at least some of this pull, relieve this swollen bone, as she calls it, even though we know it's all muscle there. And also we're going to put some botulinum toxin into these areas here so that she doesn't get that Spocky effect for that. But big lessons learned here is do not overtreat the frontalis, number one. Number two, definitely do not overtreat the frontalis and not treat the glabellar, especially on someone with shallow set eyes, because that is a recipe for not getting the best aesthetic result that you can possibly get. So that's the treatment that we're going to go ahead and do right now. Okay, we're going to treatment. Ashley, our nurse faculty member in the AAFE, is going to go ahead and treat Arlene just along the lines of what we just talked about. So where are you doing first here?
Frontalis.
Okay, so we're going to we're going to attack that Spock look on the frontalis. So go ahead. And she's just giving her a tiny bit of Botox in that lateral frontalis that is now working so darn hard because of the muscle recruitment here. There, so we'll get that out of the way, and that's going to really relieve that spockiness that she has. That'll take a few days to really go ahead and kick in. And now we're going to go ahead and do the glabellar area here, and that is going to relieve that kind of swollen bone that she feels, which is really just the muscle popping out, because that glabellar is working so hard because the forehead had so many units of Botox, and I almost dropped my camera when she said that she had 40 units of Botox in that forehead on her. So here you see the glabellar injections. The way she's holding the tissue is very strategic, the way we teach it in the AAFE. So every single injection, you need to know your anatomy. You need to know exactly what muscle it's going into to get the best effect. And this is going to really help relieve a little bit of the hoodiness, but also, what she felt was that swollen bone area right there. And now she's also going to go ahead and get some of the, she's going to go ahead and get crow's feet injections right now. And the redness and a little bit of swelling just from the Botox injections is all going to go away in the next few minutes here. So now she's doing this, and this is just crow's feet because she would like to get rid of her crow's feet. So that's this part of the injection right here. Arlene, you're doing just great. You okay? Mm-hmm. Okay, super. This is better than getting 40 units of Botox in the forehead. I'll tell you, that must have been an experience there.
That was terrible.
But you're doing just great here. So this is where we're at. And then her treatment is pretty much just about done. And then we'll check in with her in about a week and see how this all looks and how this feels from there. So now we're just going to clean her up there. And that is it. Okay, Arlene, you survived.
Oh, yeah.
You okay? You did just great there. Okay, Arlene, let's compare the treatment that you just had with the last time when you did have that 40 units of Botox in your forehead. How was this different?
Well, the first time I had it done, it was extremely, I'm going to say the word painful because it just burned. I feel like it was a lot. It was excessive. But since I didn't know, I've never had it done, I didn't know, and I thought it was supposed to do that. This time around, it really felt like nothing. I mean, a little bit pinchy on the crow's feet part, but the other stuff was really nothing compared to that the first time.
Right. So let me tell you and everybody else watching why that's so. Because with the AAFE techniques, a couple of things. Number one, I would assume because it really burned the last time you had it, that the doctor was using a different kind of saline, and we use a bacteriostatic saline, and that's got a little bit of an anesthetic in it, and you don't get that burn. And I'm sure last time it burned with the volume you had, and without using the right kind of saline, it can really, really burn. So that's one reason. The second reason is because we use these great needles called ComfortTox needles and syringes, and they are specifically made, they're 31 gauge, which means they're really tiny and they're a lot more comfortable. And it sounds like it was a lot more comfortable.
A lot more, yes.
All right, terrific. Okay, we'll see you next time.
Okay, thank you.
Okay, Arlene is back, and this is, I think, 2 weeks since we performed a botulinum toxin treatment on her because she had that very unusual situation there. First of all, Arlene, tell everybody how it feels to you.
Today, right now?
Yeah.
Oh, it feels so much better. I don't have that, I always felt like this was swollen. Like I felt like I looked angry, and I don't have that anymore. And then my frown is gone, my 11s.
Right.
So yeah, a lot better.
So that's a lot better. But you still have that heaviness. Tell everybody about the heaviness there.
You mean my eyelids?
Yep.
Yes, they feel very heavy still. And I know that's just time. They just feel very like I'm sleepy.
Right. Right. So let me now just turn the dial back and tell everybody when she came in, for those of you that remember, she had 40 units in her forehead only. And then what I don't think made the video last time, we were talking afterwards, they had told you to do what afterwards? Didn't they tell you to massage your...
massage it, pat it down.
Right. So what went wrong in her case and how did we fix it? First of all, 40 units in the forehead. Only the forehead by itself is way too much. What happened last time when she came in, those of you remember, she had this huge bulge, which was the whole glabellar complex, the corrugators and the procerus, that was working overtime. She had these deep 11s that was pulling the eyebrows down and in, wasn't looking good, certainly wasn't feeling good to her. I mean, and it's just amazing. You can see how everything is flattened out if she doesn't have that big bulge from the glabellar complex anymore, because we put some Botox in there to settle it down. Now, the only thing we cannot correct, and time's going to be the only thing that can correct it, is the heaviness of the eyebrows, because she had so much botulinum toxin in that frontalis. It totally knocked it out, and she just feels this is heavy here. Now, she's got very shallow eyes, so you and I can't notice it as much as she feels it, but really, really improved over time. But that's another mistake. Never massage, tell your patients to massage after they get Botox. They should leave their faces alone, because otherwise, the Botox gets moved everywhere into muscles where it shouldn't go. So that looks a lot better, Arlene. And now the lesson to be learned next time she comes in, we'll treat the frontalis muscle appropriately, and she must get the glabellar complex treated at the same time for really the ultimate result. So we're happy that you're doing so much better there,
Yes,
Arlene.
me too.
That's great. Okay. Thanks very much.